2020, obviously there was an increase in excess mortality because COVID was there. Then you have the mass introduction of mRNA vaccines in 2021, and you would think that there would be a reduction in excess mortality, and there just wasn't.
Florida Governor Ron DeSantis is correct that there are persistent excess deaths from COVID, and they tend to be among Republicans in his state and in Republican counties nationally. Despite widely available mRNA vaccines and variant-specific boosters, people are still dying of COVID. People who have not gotten the vaccines because they are Republican and have ingested a steady diet of partisan propaganda alleging that vaccines are somehow bad or can kill you or track you or turn you into an alien. So yes, unnecessary COVID deaths are still happening, and it is because of partisanship, not bad science, which is why the governor's decision today to inject more partisanship and widely debunked anti-vax theories into the public square, it's why it's all very deeply troubling. Today, Governor DeSantis promised to ask the Florida Supreme Court to impanel a grand jury to investigate crimes committed against Floridians related to the COVID-19 vaccine. He also promised to create a public health integrity committee to evaluate health guidance from the CDC and FDA. Joining us now to talk about all of this is Dr. Vin Gupta, a critical care pulmonologist and faculty member at the University of Washington's Institute for Health Metrics and Evaluation. Dr. Gupta, thank you for making time for us this evening. Given the data that we have now, is partisan affiliation a risk factor for contracting COVID at this point?
Alex, good evening. It certainly seems to be. In terms of getting infected, certainly in terms of ending up in the hospital, Alex, what we've seen, and I worry we're going to see this for more conditions over time, that there's a vaccine that exists, that vaccines that can prevent infection certainly prevent severe illness. It seems like blue cities are have greater prevalence and greater uptake of vaccines at the individual level. Those communities are better protected. And as a result, those hospital systems are less likely to undergo any type of stress-like condition. Certainly, we're seeing that divide across political lines.
Are public health officials communicating this to governors like DeSantis, who are doing things that actively undermine a drive to vaccinate their state populations? The sort of moral bankruptcy of this political strategy has a practical effect on their citizen mortality?
What's interesting is states, as you know, Alex, are fairly insulated, and Governor DeSantis has surrounded himself with individuals like Dr. Ladapo, and I use that honorific very lightly here, who essentially kowtows and puts up policy positions that he knows the governor is going to agree with. And the governor, I will say this, the best analogy here is what happens when the Florida health system over the last 2 years, Alex, what's happened when it's gone under stress? Governor DeSantis has invoked the National Guard because he is ultimately the commander of the National Guard and can leverage that capability to his liking to support health systems as needed. And that tells you something. He's done it repeatedly. And when you have that ability to pull that lever at your will, when you're only listening to physicians and the medical establishment that thinks like yourself, that's only giving you one side of the story, is not giving you a holistic scientific view, well, then morals doesn't even come into it, because that's the only reality that you know.
I just wonder if there's not an echo effect here, too, right? You don't have to be living in the state of Florida for this to affect you. I would imagine, and please correct me if I'm wrong, that from a public health perspective, just the mere existence of these criticisms levied by a man who may well be the Republican nominee for president in 2024, just the fact that he is out there giving air to anti-vax conspiracy theories and starting something called a Public Health Integrity Committee to look into COVID-19 vaccines has a ripple effect, right? I mean, just does the mere existence of that sort of public skepticism as voiced by someone with such a big megaphone, does that have a broader public health effect?
Yes, and his Surgeon General, if there's somebody in this room that should know better, it's his Surgeon General, who what he's done here is he's conducted a study that he's posted on the internet. There has been no peer review, Alex. And this has created essentially the underpinnings for this committee that they launched today. It's this one study that was poorly conducted. It's not scientific, but it's looking at these side effects. Let's talk about it. Let's looking at these side effects: myocarditis, inflammation of the heart. That is a rare side effect from these from the mRNA vaccines, particularly amongst young men. Somehow, Governor DeSantis and the Surgeon General think that something nefarious has gone on, that the CDC hasn't leveled with people, that this is a very rare side effect that's self-limiting, non-fatal, goes away on its own. And that is what multiple other studies, Alex, for all your viewers out there, and if Governor DeSantis, if he's listening, that's what multiple peer-reviewed studies that have been scientifically done have shown, that this is a mild side effect at worst. It's very rare. And oh, by the way, infection with the virus, coronavirus, can cause a more severe manifestation of myocarditis. They are only talking, they're cherry-picking data, they're doing bad science, and they're putting it on the internet. They're not even going through peer review. But to your point, to your very good point, by doing just that, they're telling some people out there what they want to hear. They're creating a megaphone effect around that very flawed set of data.
Just so, I mean, if you're a scientist, to do this to a population is so shameful for political ends.